Hello, I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. Now, you might be asking yourself, what's going on with this child's eyes? Well, seeing that we're dealing with primary immunodeficiencies, you should have hereditary angioedema on your differential. We're going to talk about that more. Oh, make sure you have this. Everything that we discuss is outlined in detail in this book. It's highly recommended that you have it. It's going to help you succeed on step 1 and with medical school pathology in general. It's one of the best resources for pathology, if not the best. And when you combine it with these videos, the sites, man, you're light years ahead of where likely everyone else is. So you might want to keep it a secret, or you might want to let your friends know, because if you're a good friend, you want your friends to succeed too, as long as they're not going into the same specialty as you. Am I right? No, just kidding. Help some good people. Let them know about this, because we want to share the information, right? Duty calls, our practice calls for us to be virtuous, ethical people, right? Share the knowledge. Primary immunodeficiency. Primary immune deficiency diseases, or PIDs, are uncommon immune system damaging hereditary illnesses. And like many things, since they're uncommon, they commonly show up on examinations. It's highly likely that you will be asked about each and every condition that shows up in this presentation. So make sure you have your thinking cap on, you got your coffee, you got your book, you got your colorful pens, whatever it is that you need. Make sure you have it, because this is going to be a very high yield presentation. Primary immune deficiency illnesses come in more than 200 different varieties, right? We're going to talk about the important ones. A few examples of primary immunodeficiency includes congenital neutropenia syndrome, autoimmune lymphoproliferative syndrome, autoimmune polyglandular syndrome type 1, Benta disease, Caspase 8 deficiency syndrome, chronic granulomatous disease, DiGeorge Syndrome, right? 22q11.2, severe combined immunodeficiency, X-linked agammaglobulinemia, common variable immunodeficiency, IgA deficiency, hyper IgM syndrome, and complement deficiencies. Wow, that's a lot. Low amounts of neutrophils are a hallmark of the congenital neutropenia syndromes. The rare immunological condition known as autoimmune lymphoproliferative syndrome can lead to a variety of autoimmune problems. Autoimmune polyglandular syndrome type 1 is characterized by a wide range of symptoms, including autoimmunity to various organs and an increased susceptibility to candidiasis, which is a fungal infection caused by candida yeast. Benta disease is a rare genetic immune system disorder caused by mutations in the CARD11 gene. Caspase 8 deficiency state is a very rare immune system genetic disorder caused by mutations in the Caspase 8 gene. Chronic granulomatous disease occurs when white blood cells known as phagocytes are unable to kill specific bacteria and fungi, leaving people vulnerable to bacterial and fungal infections. Let's talk about DiGeorge syndrome. DiGeorge syndrome is a congenital condition due to 22q11 microdeletion. The condition's severity varies. DiGeorge syndrome results from failure of the third and fourth pharyngeal pouches to develop. This image here on the right side of the screen shows a pathologic technique known as fluorescent in situ hybridization. it's pointing at either the normal 22 chromosome or a deleted 22q, right? You can tell it's deleted because it's not lighting up like the normal one. In regards to the symptoms of DiGeorge syndrome, they include hypocalcemia, infections brought on by a T cell shortage brought on by the absence of the thymus, dysmorphic facies, heart defects, and learning issues. Severe combined immunodeficiency, colloquially known as SCID, may be caused by a few things. It can be due to deficiencies in adenosine deaminase, which is an enzyme involved with immunomodulation. SCID can be caused by defects in cytokine receptors, and it can also be caused by MHC class II abnormalities, which predisposes to dysfunctional CD4 positive T cells. Let's talk about deficiencies in adenosine deaminase, or ADA. Adenosine and deoxyadenosine must be deaminated in order to be excreted as waste products due to adenosine deaminase insufficiency. Defects in cytokine receptors, okay. Cytokine signaling is required for the proliferation and maturation of B and T cells, right? Makes sense. And cytokine receptor abnormalities are among the etiologies. MHC class II abnormalities, which predisposes to dysfunctional CD4 positive T cells. MHC class II is required for proper functioning of CD4 positive helper T cell activation and cytokine generation. SCID is associated with defective cell-mediated and humoral immunity. SCID is characterized by recurrent infections with a variety of organisms, including live vaccines, opportunistic infections, fungal, viruses, bacteria, and protozoa. Now, how do you treat SCID? Well, have you heard of Bubble Boy? SCID is treated by sterile isolation. There's been advancements where stem cell transplant may be beneficial. Lymphocytes are toxic when adenosine and deoxyadenosine accumulate, such as in SCID. There is increased susceptibility to bacterial, viral, fungal, and protozoal infections, as well as opportunistic infections and live vaccinations, which characterize this condition. This image shows the state of a patient that has SCID. They're not on the moon. They're wearing all of this because they need to be isolated because their immune function is so impacted. Note that stem cell transplantation and sterile isolation, also known as bubble babies, are treatments. Let's move on to X-linked agammaglobulinemia. X-linked agammaglobulinemia is a hereditary or genetic immune system condition that makes it harder to fight infections. X-linked agammaglobulinemia is characterized as complete lack of immunoglobulin due to disorderedness. B cell maturation is impacted, and naive B cells do not mature to plasma cells. X-linked agammaglobulinemia is due to mutated Bruton tyrosine kinase. X-linked agammaglobulinemia is an X-linked disease. This right side of the image shows the standard X-linked recessive inheritance pattern. During the first 6 months of life, maternal antibodies are present and protective in the newborn. After approximately 6 months of life, X-linked agammaglobulinemia manifests as recurring bacterial, enterovirus, and Giardia lamblia infections. Patients with X-linked agammaglobulinemia should avoid the polio vaccinations and other live vaccines. Now let's talk about common variable immunodeficiency, also known as CVID. A broad collection of diseases known as common variable immunodeficiency, or CVID, are characterized by hypogammaglobulinemia and recurrent infections that are primarily bacterial. Defects in helper T cells, or the B cells, cause low immunoglobulin levels. Bacterial, enterovirus, and Giardia infections are more likely to occur mainly in late childhood. There's also increased risk for autoimmune disease and lymphoma. This image to the right is an H&E showing common variable immunodeficiency with absence of plasma cells in the lamina propria. IgA deficiency is characterized by decreased mucosal and serum IgA. IgA deficiency is the most common immunoglobulin deficiency. IgA deficiency is common in patients with celiac disease. Most patients with IgA deficiency are typically asymptomatic, but many are prone to mucosal infections, particularly viral infections. Here we have a biopsy showing IgA deficiency, right? Let's move on to hyper IgM syndrome. Hyper IgM syndrome is associated with elevated levels of IgM, right? IgM levels are high in hyper IgM syndrome. Hyper IgM syndrome is caused by mutant CD40 ligand on helper T cells or CD40 receptor on B cells. Helper T cells cannot receive a second signal when B cells are activated. The blocked signal does not allow the cytokines required for isotype class switching. Immunoglobulin classes IgA, IgG, and IgE are not produced. With regards to hyper IgM syndrome, low IgA, IgG, and IgE levels result in poor opsonization of pathogens, especially at mucosal locations like the GI tract. Hyper IgM syndrome is characterized by recurrent pyogenic infections. Let's discuss the important aspects of Wiskott-Aldrich syndrome, some things you'll likely be asked, right? Wiskott-Aldrich syndrome is due to defective humoral and cellular immunity. Wiskott-Aldrich syndrome is caused by a mutation in an X-linked mutation, specifically in the Wiskott-Aldrich syndrome protein gene, or the WASP gene. Wiskott-Aldrich syndrome presents as thrombocytopenia, eczema, and recurrent infections, likely involving a pediatric patient, as we can see here in the right. With regards to complement deficiencies, those are highly asked about as well. Patients with complement deficiencies, such as C5 through C9 deficiencies, guess what they can't form? The MAC attack complex. Patients with complement deficiencies have recurrent Neisseria species infections in their systems, such as Neisseria meningitidis and Neisseria gonorrhea. Meningococcal infections with unusual serotypes like W135, X, Y, and Z are more common than those with common serotypes like A, B, and C. Here we have our young friend again with hereditary angioedema, likely due to a complement deficiency. Hereditary angioedema, which is characterized by edema of the skin, especially periorbital and mucosal regions, is caused by a deficit in the C1 inhibitor. C1 inhibitor. Now, we talked about a lot of autoimmune conditions. This entire section is very important to know because lots of questions are asked on it, right? If you're going into pediatrics in any way, shape, or form, this is a must-know. For step 1, it's a must-know. For any sort of testing exam, it's a must-know. But you're on the right track because you just went through it. So bravo to you. Man, you're making me proud. You're doing such a great job. I know you're going to keep going. You're going to keep studying. You know so much. You're solidifying your knowledge. You're learning. You're growing. You're doing great. Keep up the good work. Happy studying. And I'll see you next time.